Hello and welcome to Medical Dialogues. I'm Dr. Garima Soni. Here's what I bring to you all from the world of medicine. Research links urinary incontinence to heart disease. A University of Iowa-led research team has found that urinary incontinence may be associated with a greater risk for cardiovascular disease in women. This research is published in the journal Preventive Medicine. Urinary incontinence, the loss of bladder control, is a common condition, especially in older adults. Previous studies have stated that it can affect between 38% and 60% of women. The researchers aim to find out whether urinary incontinence was linked to a decline in physical activity, which can lead to a host of healthy tissues, including greater risk of cardiovascular disease. In this study, the researchers analyzed medical records over 2 years from more than 20,000 female patients in the Hartford Healthcare system in Connecticut. Of those patients, 5.4% reported through a questionnaire to have urinary incontinence. All patients were asked to rate their level of physical activity in the questionnaire. The researchers found that the respondents with urinary incontinence did not report engaging in less physical activity than those who did not have the condition. But the team did find an association between patients with urinary incontinence and cardiovascular disease risk factors or events such as dyslipidemia, type 2 diabetes, and stroke. There is an association between the incontinence and cardiovascular disease. The study author writes, women should be screened for incontinence regularly as it may contribute to CVD risk, and women with cardiovascular risk factors should be screened for undiagnosed incontinence. Hence, it was concluded that incontinence was not associated with MVPA classification but was associated with inactivity-related cardiovascular disease risk factors and cardiometabolic comorbidity conditions. Future studies should investigate potential mechanism of this association, including incontinence severity, activity intensity, and chronic inflammation. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.